I love people. I was born to be a nurse. Have a good sleep. Deep breath. I'm Melissa York, a licensed practical nurse at the Day Surgery Unit at the Wetaskiwin Hospital. Good morning.
Good morning.
So we are going to be admitting gynecological patients for surgery. We're going to be working out of this room here. Anna, what procedure are you going for today?
So today I have my, if I say it right, I have hysterectomy.
Hysterectomy.
Yes.
Yeah. So I'm just going to put the blood pressure cuff on you, and we're going to get your blood pressure preoperatively.
I'm so excited.
Are you? Why are you so excited?
You know, I have really bad periods all my life. And people said after you have kids will get better, but it's not.
Oh, yep.
10 days of the month I'm suffer with my busy job and busy lifestyle, and I just hate it.
So you're very happy.
Very excited. Since Friday, I just can't wait.
You wanted it done on Friday. I love people. I was born to be a nurse. I've been a nurse for 17 years, and this is just my job. Like, I love the OR. The OR was great, but I like talking to people. And over there, you don't talk to people. People are asleep. So we're collecting urine for a pregnancy test, because if we're taking out somebody's uterus, you want to make sure that we're not taking out a baby as well. I have a urine here for you.
Oh, yay. I love pee.
So we just have to pop your IV in, and then you're pretty much ready to go.
Actually, that's the only one that I have nightmare is the needle. I don't scare.
Okay, well, I'm a sniper, so you don't have to worry about that. Yeah. Honestly, they call me to start IVs on other units because I don't miss. Just cleaning it, and now we're drying it. And I want a nice deep breath, and I want you to wiggle your toes. Boom. All right, so there is a rule and regulation for riding in the stretcher. Keep your hands and feet inside at all times, because I won't be responsible for taking off any of your appendages. Our goal is to alleviate as many fears as they have. Because if you have a patient that's super anxious, super high stress, their surgery journey is not going to be a nice one. We're just trying to, help them through big life changes. So this is where we do holding. Hey, Jackie. So she is going for a vaginal hysterectomy, possible laparoscopy / laparotomy, and an A&P repair. And she's super excited. You have a great sleep.
Thank you.
Okay. And then we just close this off. There we go. One of the downfalls about this job is that you don't get to see the aftercare because they are day surgeries. So we are only in their lives, preoperatively, but we don't see them afterwards. So you don't know how it changed, how their life changed, or if it was better or worse. So these are all our sterile instruments that we get sent back up from MDR. So we'll put them away. This is my favorite clinic. I love Dr. Ode's clinic just because I do have that background of an ORT. So it allows me to still use my skills that I had in the operating room. Oh,
Your patient's here.
yay! We have vaginal hysterectomy, possible laparoscopy, and then removal of both fallopian tubes. That sounds correct?
Yes.
Do you have any concerns about the procedure?
I don't think so. Everybody else has been pretty clear about it. So go in, do their thing, and then I get to not walk for a couple days and then
Right?
be uncomfortable for about 3 weeks.
Yeah, that's true. But high five, no more periods.
Right? Yeah, that is kind of a big one.
Yeah. I think our bond starts before, right? Like when we're doing the preoperative phone calls, we're building trust, right? And so if they can't trust their preoperative nurse? How are they going to trust the surgeon even? If we don't start them out on the positive track, then I feel like their experience can be less than what it could be, right? So we're going to give you a fancy hat. Don't tell all your friends about it. It like matches your outfit. You're all blue except for your purple socks.
My spray purple sock.
That's right. So vaginal hysterectomy, only allergies to bee stings.
Text allergy, Kelly?
No.
We'll see you later. Have a good sleep. Usually it's because they've had heavy menstrual cycles or pain. It's hard for them to make that decision, right? Because you're basically saying that part of your life is over. You know, like they've talked about it and weighed their options, right? Like quality of life over what you're living right now, that might make you change your mind, right? That it's time to get rid of your girl parts, you know? We have like a little thing on our med cart that like if you're at the end of your shift, just to make sure that these things are done. Just like our housekeeping stuff, restock the blanket warmers, plug in all the wows, count the narcotics, which they did, lock the med cart. Are we picked for tomorrow?
Yep, picked for tomorrow. We've set up everything in that room, just waiting for the third bed to be cleaned.
Perfect. I gotta shut down the lights. And we're gonna shut Allie in the dark.
I will get out of here and you can have your space.
No, we're just shutting off the lights. Ta-da. All right, guys, I'm going home. You guys have a great rest of your night.
Bye. Have a good one. See you tomorrow.
See ya.